Hello and welcome to DFD's AGM for the 2023 year. My name is Mike Carlson. I'm Director of Operations and happy to be coming to you with a number of other people from lovely San Juan del Sur, Nicaragua. We're down here for a number of days helping out and also taking a little vacation on the side to spend some time with students, their families, and focus on our programs. So lovely to be coming at you from here. This is our first AGM coming from Nicaragua, so we wanted it to be special there. We've got a number of people who are going to pop in for little moments, and of course we're going to start as always with the founder here, Andrew Wilson. I'm going to pass it over to him.
So I'm very happy to announce that this is the 14th year that Doctors for Doctors has existed. I'm very grateful that we get to have this AGM now that 2023 has passed back in Nicaragua. It's really nice to be back and to see the students again. It's been 5 years since I've been here due to the COVID-19 pandemic. It's really nice to be back and to see everyone face to face. Zoom just doesn't quite cut it. It's also really nice. We have our monthly Project Echo calls. We got to have our monthly Project Echo session in person this month, which was really special. We also brought in, there's another doctor here with us from Canada, Dr. Elsa, who actually gave the case report to all the students. And it was really nice to all fit around a table and discuss cases together. Right now we have 3 students. We have Noelia entering her 2nd year, we have Jimena entering her 5th year, and we have Brandon entering his 7th and final year in medicine, and he might do some specialization after, but that's yet to be decided upon. We also have our 2 graduated doctors, Dr. Brian, Dr. Kimberly. They're the official alumni group of Doctors for Doctors, and even just during that in-person clinical rounds discussion, it was one of the things that really warmed my heart the most this trip was seeing them mentor the younger year students and really enjoying that role, really taking it on completely voluntarily and with a lot of passion that they always have in when they pour themselves into work. It was really, truly remarkable to see, actually. So I'm happy that they stay involved in the program, and I'm hoping that that really shapes the direction for other students that come through the program, and I think it's really nice to see that happening. On another side, it's also really great to be here with Dr. She connects with them in a way that just I never could as a chiropractor. She's a medical doctor that's been through school and residency and all the rotations. She can relate to them in ways that I can't, especially now at this stage when it's not just about school, but it's about rural patient care. Dr. Elsa, I'll let her speak for herself, but she also gives rural patient care in Ontario, in Indigenous communities up there, and it's really heartwarming for me to see her be able to, even just the questions she asks our students and the conversations that she has with our students, it's really nice to see her develop those relationships with them, and it's really nice to see them really enjoy talking to her about that stuff. In 2024, the year ahead, we plan on supporting another student this year from a small neighborhood about 25 minutes from here. We also plan on expanding our monthly Echo Call program to include more doctors from Canada, which our students and our doctors in Nicaragua really wanted that program to expand. They wanted more medical expertise from Canada in those Project Echo sessions. To help with their specialization choices, but also just to help their rural patient healthcare in general and to be better. And so I think that's a direction we're also going to take in 2024, where we want to bring more Canadian doctors into those sessions to really help our students more. And that was kind of their idea and their plan. And we're just going to help facilitate it. I also look forward to watching the DFD family grow over the next years. You know, the years I'm now starting to understand are really flying by now that we're in our 14th year. DFD has been a real joy in my life And it's been amazing to stay connected to some of the people that I find to be the most inspiring people I've ever had a chance to work with. The fact that we just get to grow old together and practice, healthcare together is truly heartwarming. So that is everything I have to say. Thank you.
And thank you to Andrew, the founder of DFD, for that note. Let's jump over to Denise, who's joining us via Zoom. So Denise, would love to get your take on from the executive director lens.
Hi there, Denise here, and I'm happy to have been working with DFD for almost 5 years now. I'm living with my 2 teenage sons, and on weekends you can find us at the basketball court or enjoying the day at a nearby lagoon or a volcano. Trying to make a difference is what drives my work in promoting food security in rural communities. I'm a nutritionist by profession. Seeing the problems in accessing both health care and education from remote areas was what motivated me to join DFD's efforts. It's fun and inspiring to work with the medical students. They're all super dedicated to their profession, they're quick learners, and they're fun to hang out with. I feel honored to have witnessed Kimberly and Brian's years of hard work in med school, and I'm so proud of their success. Brandon, Jimena, and Noelia are following in their footsteps, well on their way to be great doctors. Noelia is happy to be studying medicine because she wants to serve people and to help patients get earlier diagnosis of their illnesses. Last year, in her first year of medicine, she was pleased to find that the instructors listened to the students, and she enjoys learning something new every day, not only about physical, but about mental health. In her free time, she art, visiting the university library, reading, singing, and dancing. Jimena has just completed her 4th year, so she's now more than halfway through her studies. She's grateful for the opportunity to develop professional, social, and personal abilities through studying medicine, and that the students put the theory they learn into practice. Jimena enjoys cooking, watching series and movies, and learning about non-medical topics. Had a very busy year with both classes and hospital shifts. He's grown into a confident professional, and after 7 years of intensive studies, he'll devote 2024 to working on his final project required for graduation as a doctor. A highlight this year for Brandon was getting engaged to his long-term girlfriend. Dr. Brian and Dr. Kimberly are DFD's 2 alumni doctors. They trained as cardiac sonographers to support a prominent American cardiologist, Dr. Matthew Lawler's research on rheumatic fever in Nicaragua. And they've been collaborating with his project for the last couple of years. They were thrilled to have an article published in a medical journal this year called Pilot Rheumatic Heart Disease Screening Program Using Portable Handheld Echocardiography in Rivas, Nicaragua. Dr. Kimberly also keeps busy giving consults in her own pharmacy in a rural community and at home playing with their 3-year-old daughter. Like Brandon, Dr. Brian is soon to be married. I'll hand over now to Mike and Andrew. Thanks for listening.
And thank you so much, Denise. Now, to switch things up, we're going to talk finances a little bit with Director of Operations here, Mike Carlson, and just want to give you updates on where DFD is at for full transparency financially. So, in a moment here, I'll cut to the financial statements so people can see what we spent and what the priorities are and how that's all working for the 2023 calendar year. And let's jump right into the 2023 financial statements. So this is the summary that I've put together, and let's go through it here. Overall, nothing big to note No major changes, issues, anything like that, but let's walk through like we always do. Overall, we're looking at 14,000 of income, and really that's about $3,000 from Canada Helps. And then it's private donations of about $8,000. Now, our specific donors, we really do appreciate them, and we've seen an increase and a shift from monthly donors to individual donors over time. That also makes sense given the age of the charity and the kinds of connections that we're making. So we fully expect this to continue increasing into the future. But around 8,000 or just under right now is doing quite well. In terms of other income, we have interest income for about $100, and then this is the same as every year. There's an in-kind donation going for storage space at $300 a month. What this essentially neutralizes, and you'll see the complementary expense down below as a donation and an expense as that are complementary. So it's actually revenue neutral. That's for rewarding folks that are storing our stuff. Thank you very much. Let's keep going. So we're looking at 14,000, just a little bit over that on the year. And then in terms of expenses, we didn't actually have any admin fees this year. That was mostly because of payment timing to Denise for the year. We normally do have about $1,000, $1,500, maybe 2,000 a year. That is just $0 this year. So we expect an increase in that, or possibly a double payment in 2024. So we're looking out for that next year. Also, our alumni didn't request any additional funding. Brian and Kimberly were doing fine and seem to have no issues or needs. We do hope and believe that this will increase with additional funding as students request and as there's more alumni who are growing. In terms of the program costs, we've made our system pretty efficient these days, and Jimena and Brandon are coming in at collectively about 7,500, just below, which is pretty good these days. Brandon, of course, making up 2/3 of that, and Jimena making up 1/3. And then $100 in banking fees to Canada Helps, another 64 in bank fees, and we had very little operating costs these days. And this is, of course, the 3,600 and in-kind storage as the expense, which is complimentary above. So overall, 14,000 in income, 11,000 in expenses. Things are looking pretty good, and we had a net of about 3,000. We were a little worried about cash flow, but with the additional donors who have come through, then we're quite in a good place. So we're sitting on about $20,000 with no real liabilities, and a net of about $3,000 on the year. If we're moving next over to the budget, looking at 2024, this is the range of budgets and how things will move over time. We're looking at the in-kind storage to remain at 3,600. We believe that we'll have more monthly donors and looking at taking on a new student. So we actually expect that to jump from around 8 to around 12 this year. And then campaigns, we may be running something specifically or looking for targeted funding. So we could see about 2,000 coming in there. Canada Helps seems to have gotten lower over time, but as people have shifted into major donors or pulled off. And then this miscellaneous piece is going to be our trip. Now, again, the charity is not paying for anyone to be down here. All the volunteers who have come down to Nicaragua on the trip are paying that cost, but they're paying it through the charity, so at least they're getting a tax receipt for that. So it is revenue neutral. Folks will be donating that money to the charity, and then the charity will be buying the flights and paying for the accommodation. As part of the intensive week of work that's being done and everything that needs to happen down in Nicaragua. So we expect that to be around 10,000, but we're still fleshing out the details on the trip here. In total, we're looking at about $30,000 in revenue, which is an increase from other years by 10,000. We believe it's certainly the trip funds as well as some increases elsewhere on the board. In terms of expenditures, this will be the trip funds that will be covered. We expect Brian and Kimberly to be requesting some money, as well as new student Noelia, and Brandon continuing to ask for his, and the executive director salary and payments, which should be coming through and may even be higher than that. So when you add that all up, we're looking at about 28,000 here. We expect to be fairly balanced this year with a net income of about $2,000. So hopefully we can keep building that base of coverage. All right, and those are the financial statements. Now switching gears, we want to head over to some of the different volunteers that are able to join us for the AGM. Some from Nicaragua and some from afar. So just want to say hello to these lovely folks, and always a pleasure to have them around.
So, my name is Elsa Dinsdale. I'm a family doctor that practices in Toronto, Ontario. It's my first time down here in Nicaragua with Doctors for Doctors, and it's a privilege to be here with this group. Typically I work in northern Canada, in rural and remote communities, Indigenous communities out of Sioux Lookout. It's been really interesting to connect with some of the communities here and the medical students that work in this region. It's also been really inspiring to hear some of their stories of what it's like to try and get into medical school and fund and the work that they do. So it's been really interesting to hear about from the medical students, their experiences. It's really touching, some of the stories and how they're involved in their communities and supporting a lot of vulnerable people in the hospital system. Certainly, it's been a wonderful experience starting to work with DFD, and I'm excited to be working with them more in the future.
Hi, I'm Justin Barnaby. I'm a community pharmacist in southwestern Ontario. It's been a tremendous experience to get to know Doctors for Doctors, take a peek behind the curtain and understand how it works a bit. Obviously I have a lot more to learn, but it's been wonderful meeting the students and the local partners and just seeing how mindful everyone that works for them is in how they integrate into the community and lean into those partnerships. I think there's tremendous opportunity to mentor students, and it's been wonderful to get to know them and understand how passionate they are about their communities and giving back. I've had a wonderful experience, and I look forward to seeing what happens going forward.
Hi, my name is Amanda, and this is Kyle. It's been a total pleasure to be able to join this trip down here in Nicaragua. I've been kind of on the periphery of and had the total pleasure of getting to know DFD over the last couple of years, and it's been wonderful to actually meet the students. I also have a very personal interest in this space as well, and this trip been able to connect and discuss some aspects around some of my work around food systems and international development work. So it's been a wonderful pleasure, and also supporting this one to the newest member of DFD, or soon to be, probably maybe on the future board. We'll see. Kyle, and getting her to also meet all of these students that have been fostered through this program for so many years. So it's been an absolute pleasure.
The director of cuteness.
Yeah.
Yeah. And she is crushing her job. Yeah.
And that does it for the DFD AGM for 2023. Thanks to everybody who joined, and as always, thank you so much to our monthly donors, to our donors that are supporting students specifically. We couldn't do this without you. We're so grateful and appreciative of everything that you do for us to support our work, especially while we're down here in lovely Nicaragua. So, signing off from the 30-degree weather here, and looking forward to a year coming up. Thanks so much, folks, and we'll see you later.